Patients who are more active in engaging their health and their healthcare decisions tend to make better decisions about their care. And so telehealth, particularly the Sniffle Health platform, is a resource to help patients become more activated about their care and to identify the right setting in which to receive care, and in many cases to resolve a care issue through a telehealth consultation as opposed to driving 30 minutes or an hour to a physician's office.
Patients love convenience. I love convenience. Google, Amazon, Netflix, Spotify, mobile banking, they've all given us and set an expectation of what we want as consumers in our life. Patients deserve the same thing. Patients deserve to have the ease and convenience with the accuracy that all of those other examples, right? All of those organizations, they don't just exist online, they exist flawlessly online. And that's what Sniffle Health is going to be able to do as well for the patients.
I also think that providers are a beneficiary because Sniffle gives them the ability to see patients virtually in an easy way that isn't cumbersome or doesn't take away from their daily work and their clinic, and because they can set their own schedule and their own time to be able to take care of their patients.
And our approach creates freedom for the physician, for the patient, and for us. A family can download that Sniffle app, and in their hand, they have a medical device for their whole family they can check symptoms on. It's simple, easy to answer questions, touch a button. It's the only app that I know of that is certified by SureScripts and the DEA to allow a physician to self-credential. We never have to even speak to the physician if they don't care to speak to us. They can self-credential, and within hours, they can be up writing script and treating patients on the app. We don't need to be involved. They don't need to fax a license. They don't work for us. We don't get involved with paying them. We don't get involved with their revenue cycle. The app is theirs to build a practice with.
It's very easy to document in the app. It's very easy to see the patient, accept an appointment, schedule an appointment. All of those things are very simple, whereas a lot of times in face-to-face practice in the clinic, it takes a whole team of people, a lot of workflow changes, a lot of clicks and checks in an EMR to actually make a patient visit happen.
This isn't about some sort of static platform that someone conceptualized on day one. It's about a commitment to continue to improve this platform to be a resource for patients, to be a resource for physicians. And most importantly, I think, is that Sniffle Health is focused on having a broadly accessible resource and understands that the value in this space is not for Sniffle Health to employ providers of care and to be a telehealth company that employs and directly delivers the telehealth associated care, but it provides a resource that's available to patients and their caregivers, that's available to primary care physicians, other providers.
I'm a mom. Kids inevitably get sick after hours on the weekends, and it's frustrating sometimes not to be able to have access to care when and how I need it. And so just from a personal perspective as a patient, I think it's very important to have that access to my provider, not just any provider, but my provider when I need them, or my child's provider. And, it'd be a simple process. If the provider is there, they can connect with them, they can see their schedule. If they don't have a provider, then they can choose one that they know has been credentialed and vetted. And then if they do have a family practice provider that they don't see on the Sniffle app, they can search and invite them to join.
When a patient downloads Sniffle, they can get an diagnosis, they can be able to use a pharmacy discount card immediately, they can book an appointment to see their physician. All of that exists for them without any cost up front for them to be able to experience that. And most powerfully, in my opinion, is they get to share this with their whole family.
With Sniffle Plus, patients also get vision, dental, behavioral health, and a number of other features, including unlimited booking on Sniffle.
This is a really powerful thing to be able for a physician to give her patient and say, I want you to be more proactive in your healthcare. I want you to be healthier, and here is a tool that I am providing to you to do that.